How many people do you know that have needed blood? According to a webpage by redcrossblood.org titled Blood Needs and Blood Supply, someone in the United States needs a blood donation every 2 seconds. Odds are that you have either needed blood or know someone that has needed blood. I've been spending the past couple of weeks researching the statistics and process of donating blood. My father has always given blood. However, until I've done my research, I never realized exactly how important it was. The need for blood donations is increasing, but the supply is decreasing. Today, I'm going to talk about the need for donations, how easy it is to donate, and what these donations do to help others. To begin, let's talk about the need for blood donations and why it is important for you to donate. Many people who are eligible to donate simply do not. According to an article in the U.S. News from June 14, 2018, titled "A Plea to Young Americans, Donate Blood," only 38% of Americans are eligible to donate. Some common things that could disqualify you from donating would be being born, lived, or visited a country that has transmissible diseases that are only found in that country, sexual contact that causes transmissible diseases, using needles to take drugs not prescribed to you, or having been in jail for more than 72 hours over the past 12 months could also cause you to be ineligible. Out of this 38% who are eligible to donate, only 10% actually donate on a regular basis. What's even worse is that out of this 10%, 60% are above 40 years old, and they will not be able to donate forever. It is critical for everyone who can donate to donate, but it is even more important for the younger generation to donate. Blood is essential for treating chronic diseases, surgeries, and traumatic injuries. Every 2 seconds, someone in the United States needs blood. 1 in 7 people to enter a hospital need blood. It is important that we have plenty of this blood ready for any emergency that could occur. So now that we know about the need for blood, let's talk about how easy it is to donate. 2 of the main reasons why people do not donate is because they are afraid of needles and don't take the time to schedule an appointment. One way to get over this fear of needles would be to simply gain experience. The more you give blood, the more you get comfortable with needles. According to an article on memorialcare.org from September 5th, 2018, titled "How to Overcome a Fear of Needles" from someone who has actually done it. It is possible to overcome your fear without even knowing it. The person who wrote this article was forced to give blood weekly due to a disease that causes her to have low platelet counts and bruise easily. For her to overcome her fear, she simply just got used to it. After realizing she had overcome her fear, she even realized how minimal the pain of the needle really caused. Some other ways to overcome this fear of needles are both physical and psychological. As in the case with many phobias, therapy is a good way to cope with your fear. These therapists will also try to figure out why you have this fear and then give you treatment accordingly. For example, if you have a fear of needles simply because of anxiety, then they will probably give you some medication that can help lower those anxiety levels prior to the appointment. Sometimes things as easy as deep breathing, reading, or listening to music can lower anxiety levels. If the cause of the fear is physical, then there are different treatments. There are different numbing creams or gels that can be applied over the injection site prior to the appointment, as well as devices that can transmit a cold vibration sensation onto the skin that can help distract the patient. The other reason why people don't donate is because they simply don't take the time. According to a webpage from thebloodconnection.org titled "Important Donor Information," the whole process only takes about an hour. If you make a platelet donation, then you can donate once every 7 days and only 24 times in a calendar year. Plasma, you have to wait 4 weeks. The most common form of donation, whole blood donations, forces you to wait 8 weeks between donations. So let's assume you do whole blood donations. This takes 1 hour out of 8 weeks to perform the process. If you do the math, all you have to do is take 1 out of the 1,344 hours within that 8-week period. One donation can save up to 3 lives. So if you simply just take 1 hour out of this 8 weeks, you can easily save the lives in your community. Now that we know about the need and how easy it is to donate, let's talk about who benefits from these donations. After you have finished donating, who receives your donation? According to a webpage by americasblood.org titled "Blood is Always Needed," the people who receive the most blood are cancer patients. How many people do you know that have had a type of cancer? Your donation could help save the lives of up to 3 patients within your community. Surgeries are another common recipient. Orthopedic and cardiovascular surgeries are some common types that need blood donations. Some of the most frequent reasons why people end up in the hospital call for a large blood donation. Things as simple as bad car accidents or even childbirths often call for a lot of blood to help save either the person who was in the wreck or the mother and her child during birth. Today, I've talked to you about how the need for blood donations is increasing, but the supply is decreasing. So many people need blood donations, but sadly, people are just not donating. Everyone who is eligible to donate should donate, but it is even more important for the younger generation to donate. Many lives would be lost if people stop donating, and it is critical for everyone to know the importance of just giving a little bit of your time to help others in need. So, as you go on with your day, try to talk to a frequent donor and see what they have to say about the importance of giving blood. And as you leave, think about where you can find that 1 hour to help save some people's lives.